So what is the articular system? It's basically the joints in the body. For example, like the knee joint, the shoulder joint, and the sutures in the skull. So all of these joints make up the articular system. Articulations, they're sites where the bones meet. For example, here we have the femur. It meets with the tibia and the patella. We have in the shoulder joint, the head of the humerus meets it with the glenoid fossa of the scapula, and so on. In total, there are 230 joints in the body, and there's actually one bone called the hyoid bone, which doesn't articulate with any other bone, and it's held in place by the neck muscles. Okay, so functions of the articular system, they give mobility to the skeleton, so they allow the bones to move, and they hold the skeleton together. Okay, so let's talk about classification of joints. We have a structural classification, and we have a functional classification. The structural classification refers to the material, so what the joint is made out of. For example, we have fibrous joints, like the sutures that connect the bones of the skull. We have cartilaginous joints, like the joints that connect the ribs to the sternum. And we have synovial joints, like the shoulder joint and the knee joint. And we'll talk more about each in the upcoming slides. And then we have something called the functional classification. And the functional classification refers to the movement that's allowed at the joint. So the degree of movement at the joint is the functional classification. So we have immovable joints, joints that can't move. Like, for example, the sutures between the bones of the skull, they are immovable joints. We have slightly movable joints, like the intervertebral discs, which connect the vertebral bodies. They are slightly movable. And we have freely movable joints, like the shoulder joint and the knee joint, and the hip joint, and so on. Okay, so in terms of structural classification, we have three main types of joints. So we have fibrous joints, and then we have three types of fibrous joints. We have cartilaginous joints, and then there are two types. And we have synovial joints, and there are actually 6 types that are based on design or shape. And the synovial joints are characterized by a joint cavity. And we'll talk about this later on as well. We'll go into more detail. So functional classification. So here we're talking about the movement that's allowed at the joint. Immovable joints are called synarthroses. Arthro means joint, and syn means together. So if you imagine two bones articulating together, they can't move. So immovable joints are synarthroses. And then we have freely movable joints. They are called diarthroses. Dia means through or apart. So if you imagine two bones that are apart, they can move. So that's a good way to remember them. And an arthro means joint, obviously. And then between immovable and freely movable are slightly movable joints, and they are called amphiarthroses. So let's talk about some general rules. So freely movable joints or diarthroses, they predominate in the limbs or the appendicular skeleton. So examples of diarthroses or freely movable joints include the elbow joint, the shoulder joint, the knee joint, and the hip joint. And as you can see, they're all in the appendicular skeleton or the limbs. And then immovable and slightly movable joints, so synarthroses and amphiarthroses, they are highly restricted to the axial skeleton. So for example, the sutures in the skull, the fibrocartilage or the intervertebral discs between the vertebrae. So these are examples of immovable and slightly movable joints, and usually they are restricted to the axial skeleton. Fibrous joints are immovable, and there's only one exception. Remember, fibrous joints are 3 types. We'll talk about them later. They're all immovable except one type. And then synovial joints are freely movable. And cartilaginous joints are 2 types. One is immovable, and one is slightly movable. Okay, so let's talk first about fibrous joints. There are 3 types. In fibrous joints, the bones are connected by fibrous connective tissue. Like I said, they're all immovable except one. So the sutures are the joints between bones of the skull. And then we have something called syndesmoses. Desmo means connection or ligament. So syndesmoses are bones connected by ligaments, and this is the exception. This is the joint that can be slightly movable. So, and then we have gumphoses, which are articulation of teeth with the alveolar process. So right here, this is called the alveolar process. The articulation of the teeth with the alveolar process, we call this gumphoses for singular, or gumphoses for plural. Okay, so let's talk about sutures. They're the joints between the bones of the skull. So for example, here we have the sagittal suture. Here we have the coronal suture. Here we have the lambdoid suture. So these are examples of sutures, and this is the first type of fibrous joint, and they are immovable. So sutures are considered synarthroses. So syndesmoses, like I said, desmo means bond or ligament. So syndesmoses are bones connected by ligaments or bands of fibrous tissue, basically membrane. So bones connected by ligaments or membrane are syndesmoses. The movement allowed depends on the length of the connecting fibers. So the longer the fiber is, the more movement is allowed, and we'll talk about examples. So here, this joint here, between the tibia and the fibula, is called the distal tibiofibular joint. And there's a short ligament. So here there is little or no movement because the connecting fibers are short. And then another example here is the interosseous joint, or the radio-ulnar syndesmosis. And here the radius and the ulna, are connected by something called the interosseous membrane. As you can see, the connecting fibers are long, so there's relatively a large amount of movement compared to the distal tibiofibular joint. Okay, so let's talk about gumphoses. Gumpho means nail or peg. So the tooth is kind of like a nail or a peg, and it articulates with the socket of the alveolar process. So right here, this is the alveolar process, and this is the socket. So the articulation of the teeth with the socket of the alveolar process, we call this gumphosis or gumphoses. And then the connection between them, between the tooth and the socket of the alveolar process, is the short periodontal ligament right here. So these little white fibers are the periodontal ligament, and they're basically the fibrous connection between the teeth and the socket of the alveolar process. Okay, so let's talk about, we're done with fibrous joints, which included the sutures, the syndesmoses, and the gumphoses. Now we'll talk about the cartilaginous, and they are two types. We have first synchondroses. Synchondroses are basically bones connected by hyaline cartilage, and they are immovable. So they are also synarthroses. Syn means together, and chondro means cartilage. So bones connected by hyaline cartilage. We call this synchondroses. And then we have symphyses. They're basically bones connected by fibrocartilage, like the intervertebral discs, and they are slightly movable because you can move your spine, so you can think of it that way. Synchondroses are considered primary cartilaginous joints, and symphyses are considered secondary cartilaginous joints. So, for example, an example of primary cartilaginous joints would be the costochondral joints that connect your ribs to the sternum, and we'll talk about this in the upcoming slides as well. And then symphyses, example of symphyses would be the intervertebral disc between the vertebral bodies. Okay, so synchondroses, which are immovable, so they are synarthroses. They are connected by hyaline cartilage. Example are the growth plates or the epiphyseal plates in the long bones of children. So right here, this is the growth plate or the epiphyseal plate. It's basically hyaline cartilage connecting this bone and this bone. They are temporary. When someone hits puberty, it ossifies, so it's replaced by bone. So it's a temporary joint. And then the joint between the first rib and the sternum, for example. So here we have the first rib, and then this is the sternum. This is basically costal cartilage. We call it a costochondral joint. So costochondral joints are also considered synarthroses, and it's basically hyaline cartilage. So right here, these are costochondral joints. Costo, which refers to ribs, and then chondral, which refers to chondrocytes, because it's hyaline cartilage. So they connect the ribs with the sternum. They're called costochondral joints. Okay, next we have symphyses. They're bones connected by fibrocartilage. They are amphiarthrotic, so they're amphiarthroses. They're slightly movable. Fibrocartilage is compressible. It acts as a shock absorber. So here, for example, we have the spinal cord. This is the vertebral body, and this is the transverse process and the spinous process. And right here, we have the intervertebral discs, which are fibrocartilage. They are symphyses. They're basically shock absorbers. So imagine you're doing push-ups on a pillow. The pillow sucks your energy. So you can think of the intervertebral disc like a pillow. It's a shock absorber. And then another example of a symphysis or a fibrocartilage that connects bones is the pubic symphysis, which connects the two pubic bones. Okay, so next, we discussed the cartilaginous joints, which are two types, the synchondroses and the symphyses, the hyaline cartilage and the fibrocartilage. So now synovial joints, they are 6 types, and the 6 types are based on design or the shape of the joint, and we'll talk about them in part 2. So synovial joints, they have a fluid-filled cavity. So right here, this is the joint cavity, and it's filled with synovial fluid. It includes nearly all joints of the limbs, like the knee joint, the shoulder joint, the hip joint, and so on. And they are freely movable. So they are diarthroses. And we'll discuss features of synovial joints later on as well. Okay, so let's summarize. So for immovable joints or synarthroses, because remember syn means together. So bones that are together, they can't move. So immovable joints or synarthroses, they include the sutures between the skull bones, the joint between the skull bones. And then we have gomphoses, which are the articulation of the teeth with the alveolar process. And they're connected by the periodontal ligament. And we have synchondroses. The synchondroses, they are the bones that are connected by hyaline cartilage. Okay, and now slightly movable joints, also known as amphiarthroses. We have syndesmoses, which are the bones connected by ligaments, because remember desmo means ligament, like the distal tibiofibular joint, which is connected by that short ligament, and like the interosseous membrane, which connects the radius and the ulna. And then we also have symphyses, like the intervertebral discs and the pubic symphysis. Okay, so and finally we have freely movable joints, also known as diarthroses, and they're basically the synovial joints, like the hip joint, which is formed by the femur and the acetabulum, the elbow joint, which is formed by the humerus, the radius, and the ulna, and the shoulder joint, which is formed by the head of the humerus and the glenoid fossa of the scapula. Okay, so let's talk about the features of a synovial joint. We have the articular cartilage. So right here, this is the articular cartilage. It's basically hyaline cartilage. They basically act as shock absorbers. They absorb compressible forces to protect the bone surface. Then we have the joint cavity. The joint cavity is basically the space over here. It contains synovial fluid. The synovial fluid is produced by synovial membrane. So here in green is the synovial membrane. It produces the synovial fluid. And then we also have the articular capsule, also known as the joint capsule. The joint capsule is made by the synovial membrane and by an outer fibrous layer. So this right here is the joint capsule, the synovial membrane and the fibrous layer. And we also have reinforcing ligaments. We also have reinforcing ligaments like this ligament over here. And then finally, nerves and blood vessels.